Morning, my name is Barry Elsholz. I'm a pilot for Air Methods Corporation. The program that I work at is Orlando Regional Medical Center, and this is AirCare 3. AirCare 3 is an Airbus EC-135 helicopter. It has two engines. The EC-135 helicopter, albeit the parent company is Airbus, it was originally a Eurocopter. The EC-135 is made in Bavaria, Germany. This is a medical configuration. We have a patient litter that is removable through the back of the aircraft, the clamshell doors. So we do have 3 seats in the back along with the patient litter for my flight nurses and flight paramedics. And then we have 2 seats up front, one for the pilot and for an observer or nurse or paramedic. This aircraft is equipped with radar. This is the high skid configuration. This is a 2-engine aircraft. It does have an inlet barrier system. If you're wondering if these are sticking out, there's one on the left side and one on the right side. They're both large oxygen bottles for our patient and patient care. Coming back here, this is a Fenestron type tail rotor. So instead of just having a 2 or multiple bladed tail rotor system, it's actually enclosed, and it tends to be a little more efficient, but does have a different feel for the pilots. It's also considerably quieter than a normal tail rotor. You really want to avoid the tail rotor at all possible costs. It does rotate very fast, and if you put your hand in there, it'll take it right off. This aircraft has 2 engines. They're both Pratt & Whitney engines. They're just shy of 500 horsepower per engine, which is more than enough power for this particular aircraft. It does have the ability to fly on one engine if for some reason one of the engines malfunctions and we lose it. We end up usually flying at an indicated airspeed of about 120 knots. That equates to, on a normal day here in Orlando, about 125 to 130 miles per hour if you were, say, driving by car. One of the things that we like to use at night, these are night vision goggles. These attach to our helmet, and we are able to see through them at night. Those are the military grade type NVGs, and we actually did get them from Department of Defense. Our normal range is in minutes, and it's about 2 hours. For this aircraft, AirCare 3, we routinely go up to Jacksonville, Gainesville, and sometimes Miami as well. So pretty much the majority of the state east of Tallahassee. This is the cockpit of the EC-135. This is a very basic and simple cockpit compared to most. It is partial glass. That allows me to see my systems and instruments. It tells me if there's a problem with the aircraft. I'll get a segment light, and it'll come up either in yellow or red, red being a warning. Other engine instruments as well as far as temperatures and pressures. I do have an engine control panel, which is right down here. It makes up of basically those switches. For navigation and radios, I have a Garmin stack of a 530 and a 430, which also displays for me radar and traffic awareness. So it tells me where other aircraft are, all right? And then my basic 6-pack instruments as far as attitude indicator, altimeter, airspeed, and horizontal situation indicator, vertical speed indicator. And then being that it is a helicopter and we do go out and land on roads, we have the radar altimeter that actually tells me my altitude above the ground. We do have a siren on the aircraft, which you can actually pulse it or put it in wail or yelp. Next to that, I have an additional radio, which allows me to talk to personnel on the ground, which is usually fire and EMS or police if necessary. Also, when we bring patients into the hospital, we are required to give a patient report, and that's the radio that we use to give a patient report prior to landing, so they're ready for us down in the trauma center. But what we use this aircraft for are pretty much 2 different types of patients. So we'll do an inter-facility transfer, and that's going from one level of care to a higher level of care from hospital to hospital. And then the other thing that we like to do are scene calls. So if there's, say, a car accident and we need to go out and pick somebody up and bring them to the trauma center, we have that ability as well. That's why we have a lot of the additional equipment on board. As far as the flight controls go, this is a cyclic. The cyclic control, as you can see, it has several buttons on it, but it's more towards the systems of the aircraft, not necessarily flying the aircraft. Down at the bottom of my feet are 2 pedals. That's for directional control or yaw control. It makes pitch inputs to the Fenestron tail rotor, left or right. Right here, I have what is referred to as a collective. So when you pull up on it, the main rotor system will increase all 4 blades collectively or decrease them as I push it down. I also have engine controls on the collective as well if I need to operate the engines manually. Normally, the operation of the engines is done with the FADEC, a computer that manages the engines.
Hi, my name is Ty Campbell. I'm one of the flight nurses for AirCare. This is one of our air ambulances, our helicopters. I've been flying in this helicopter for 8 years now and currently flying at AirCare 3. So we actually have 3 of these helicopters. In the back of these helicopters is just like a hospital. So we pick up people at hospitals. We pick up people if you're in a car accident. We pick up people that have fallen. But if you get hurt and you need to go to the hospital really, really fast, that's what we do. So let me tell you about our red suits that we wear. So our red suits are actually made out of material that keeps us safe. So it keeps us, if it gets really warm, it actually keeps us cool, and vice versa. If it gets really cold, it keeps us warm. And in these suits, if you notice, we have a lot of pockets. So we keep our pens, we can keep our IDs, our keys, all of our phones and our equipment all stay on our person, including we keep scissors with us. We keep our stethoscope down here so we can listen to somebody's heart and their lungs and how they're breathing. Anything else you would need, we keep on our person, because as you can tell, it's really tiny. So everything we need to bring to the patient. So this is the back of the ambulance where we take care of the patients. So back here, we have everything we'll need to take care of somebody. So in this bag right here, we actually keep all of our medications. So all the medicines that you would need. So if you're in a lot of pain, we have pain medication in here we can give you. If anything else, everything we need is carried in here. Then right here is actually the bag. This carries a lot of equipment. So any type of pumps or any other things that we need, we carry in this, and we actually carry this everywhere we go. So that's why we have a backpack, so we just carry it on our person. This is our Zoll monitor. So with this monitor, we can actually pay attention to how you're breathing, how your heart's doing, and we can do everything with that. We can also, over here is our ventilator. And the ventilator, if you need help breathing, and you need us, we can actually do that for you so you can rest. And as you can see, everything back here has a lot of pockets. So every little pocket has something in it that's needed. So we have backup batteries, we have blow-up stuff to help the IV fluids going quicker. We have everything you would need is within an arm's reach, because it's so tiny and there's only 2 of us that work back here. So we want to make sure we don't have to ask for help. We can do everything just right here. We also carry this really cool cooler that if you get cut and you have a really bad cut or you have something where you're going to need some other stuff, we can actually give you blood. So the same blood that comes out of you, we can give you back. So we keep it in this cooler, and anybody who needs it, we're able to give it to them. In this center console, we have all of our additional medications, and they're in drawers, and the drawers actually lock. So when you're flying along and you're going back and forth, they don't come open on you. It's not like a regular drawer. These drawers actually lock. You have to press a button in order for them to open. So every single one of our aircraft have these. Every seat does. So this is actually how we talk to each other. We each wear special helmets, and on those helmets, we have a mic, and we can actually talk. And as we talk, we can talk to each other. And then if we press this button, we can actually talk to all the hospitals around the state, and we can talk to other aircraft just by pressing this button. So everything you need in the back of here can be done to help take care of the patient. This is actually our helmet that each one of our crew members, our pilots, and the medical crew wear. It's got these really cool ear protection. So when it goes up against it, it makes everything quiet except for the noise of people talking. This is the mic that we talk into, and then each one of these comes with, you can either put a clear visor down, or you can actually put essentially sunglasses. So you have your own sunglasses in the back if it gets kind of bright. So let me show you how each one of us wear. So we actually wear this, and then as you can tell, it's really, really tight back here. So we have to be everything's got to be in one small area. So you kind of have to do all of your work with the patient who's right here, but yet you have to also sit in this very tight seat with your helmet, but it keeps you safe so you're not moving around too much. And then each one of our helmets, like I said, we keep our cool sunglasses that we all get to have. And with Florida, it gets very bright, so you want your sunglasses. All of our helicopters have these radios. So these radios actually talk to almost every hospital and every ambulance that you see, all the fire departments. We actually have them programmed in this radio. So each one of these dials that we dial to will actually pick who you're going to talk to. So if you want to talk to a hospital, you turn it to here, and then the box earlier, like I showed you, you're going to press this button, and as you hold this button down, you can actually talk to whatever hospital you're trying to get a hold of. This also can give us, if anybody wants to call us, it'll actually beep off so we know that they're calling us, so we can immediately switch to that channel and talk to them as well. But these radios actually work across the state. So as we're coming to the back of the helicopter, if you notice when we were inside the helicopter, it was very tight and the patient laid right next to us. So we're not gonna be able to put those patients that are laying down through our doors. We're gonna actually have to put them somewhere else. So what we do in these helicopters is we load them in through the back. And each one of our stretchers actually has wheels and will go up and down based upon however we move it. So I'm gonna show you how this is done. So these doors are what we call our clamshell doors. So they have 2 locks on them. And when we unlock it, your patients will actually load up into here. So these are our little gurneys. So the gurneys can actually hold 400 pounds of a patient on there. We unlock it, and the stretcher comes out, and the wheels will fall on their own. So as the wheels fall, you unload the patient, and you just walk them to the hospital. From here, when you have a patient on here, you have to load them at anywhere from either a hospital or from an accident scene. You actually have to pop up the front like this. So they actually go up a little bit. And then you lift it and you'll see the legs will actually break down and it locks in place. So you load your patients there and then you'll shut this so it's not as windy for them in the back. You'll shut these clamshell doors the same way you open them, and it's nice and secure. Well, thanks for coming out and looking at our really cool aircraft and the most amazing job that I think people could have. Hopefully we'll see you guys flying over and you guys give us a wave, we'll wave back, and you guys have a great day.